Bacteria causing toothache. Toothaches are primarily caused by bacteria that feed on sugars and starches in the mouth, creating acids that erode enamel and cause infections. The leading culprit for cavities is Streptococcus mutans, while gum diseases and abscesses are often caused by mixed anaerobic bacteria, such as Porphyromonas gingivalis and Treponema denticola. Let's discuss these key bacteria involved in toothaches. Streptococcus mutans. It is the primary bacterium responsible for tooth decay, cavities, and associated pain. Porphyromonas gingivalis and Treponema denticola. It is commonly associated with periodontal gum infections, which cause dull, persistent tooth pain and abscesses. The last bacteria is Actinobacillus actinomycetum comitans. It is related to more aggressive, localized gum infection. How do these bacteria cause pain? Cavities. Bacteria in plaque break down sugar and produce acid that erodes enamel. When decay reaches the inner nerve chamber, it causes severe pain. Abscesses. Bacteria infect the pulp, nerve, of the tooth or the gums, creating a pocket of pus that causes throbbing pain, swelling, and sensitivity. Gum disease. Bacteria causes inflammation and infection, causing gums to pull away and exposing sensitive root areas. Now let's discuss their detailed bacterial profiles. The bacteria involved in toothaches have distinct biological characteristics that dictate where they live and how they cause damage. Streptococcus mutans. It is a gram-positive coccus, round-shaped, that often forms chains. It is a facultative anaerobe, meaning it can survive with or without oxygen, though it thrives in the oxygen-poor environment of dental plaque. Its primary nature is acidogenic. It converts dietary sugars into lactic acid, which dissolves tooth enamel. Porphyromonas gingivalis. It is a gram-negative rod that is strictly an obligate anaerobe. Because it cannot tolerate oxygen, it hides deep within periodontal pockets or the roots of teeth. It is known for its proteolytic nature, meaning it breaks down the proteins in your gum tissue and bone, leading to severe inflammation and abscesses. Treponema denticola. It is a gram-negative spirochete, characterized by its unique spiral shape and corkscrew-like movement. Like Porphyromonas gingivalis, it is an obligate anaerobe. It is highly mobile and invasive, allowing it to penetrate through tissue layers in the mouth, which often contributes to the throbbing pain associated with advanced gum disease. Aggregatobacter actinomycetum comitans, formerly called Actinobacillus. It is a gram-negative carcobacillus, appearing as a short, oval-shaped rod. It is a facultative anaerobe that is particularly capnophilic, meaning it thrives in environments with high carbon dioxide. It is naturally aggressive and is a major player in localized, rapid-onset bone loss around the teeth.